Hello, everyone. My name is Nicole Hawkins, and I am a registered nurse and have been a registered nurse in long-term care for going on about 14 years in one capacity or another. And the reason I'm making this video is because I want people, specifically nursing students, to look more into being long-term care nurses and not necessarily just hospital nurses. I read this article from it was based in Canada, but I read this article and it was the top 10 myths about nursing home nurses or long-term care nurses. And I use those two terms interchangeably because to me it's still a nursing home, but long-term care is much more than just the nursing home aspect of things. So long-term care nursing does more than just the nursing home piece of things, but for purposes of this video, I would like to discuss more of the nursing home side of things and what to expect. And so I would like to start sharing my screen so that you can see that the PowerPoint that I have made. And while I will not go directly just from this PowerPoint this whole time, this is more of just a guide for you to kind of see where I'm coming from, what I'm talking about, and kind of keep us all on task. So long-term care nursing, the purpose of this presentation is to educate nursing students and even current nurses about long-term care services and to debunk a lot of the myths about long-term care nursing. So by the end of the presentation, I am hoping that you all will be able to know the skills that are required by long-term care nurses. You know, it's not just being able to pass pills and, you know, help change people and do wound care and those kind of things. It's so much more. Also want you to know about the new technologies that are being introduced into long-term care facilities. The average pay for nursing home nurses is a huge discussion. A lot of people think that, oh man, the pay is horrible, so I want to educate you about that. There's many challenges that nursing home nurses face, and I don't think that a lot of people understand the severity of some of these challenges and what to expect and those kind of things. So we'll talk about that. The purpose of the long-term care facilities, you know, why do people go there kind of thing. The responsibilities of long-term care nurses, because they are numerous, and the rewards of long-term care nursing and the working relationships, and last but not least, the benefits of becoming a long-term care nurse. So a little bit about my background. Like I said, I have been in the nursing home long-term care industry since I was 18, and I started out as a CNA, and I think that that was really important for me because that's where I fell in love with long-term care. Just being able to care for those people and give them the dignity and respect that they need and deserve was very important to me. So starting that at 18 years old, being a CNA at a nursing home in Kearney, Nebraska, and then working my way up, went back to school and got my licensed practical nursing degree and started, you know, doing that. But still, even, you know, despite all the clinicals and the hospital settings and the different other settings that we went into, my love and my passion was still with long-term care nursing. And then I went on to get my RN, got my associate's degree, and continued to work in long-term care. And as I was starting to get more education behind me over the years, I began to not only be a bedside nurse, but I also was getting more into the administrative and the management side of things. And then I got my bachelor's degree in nursing and was a DON before I even got my bachelor's degree at a nursing home. And now I'm working on my master's degree with a specialization in nursing education. And I really would like to be able to teach geriatrics side of nursing. Also big into educating the community as well. And I chose long-term care because I love the people. The smiles you get, and not that I'm saying that it's all, roses and that kind of thing, but the smiles you get are far outweigh the negativity that comes along with long-term care. You deal with a lot of folks that have dementia, a lot of people that don't know who you are, don't want, to be changed, don't want to take their medications. And so you become very creative, and you reach out to other people to try to help you to manage these kind of things. So just keep that in mind too. I'm not going to tell you that this is all easy peasy kind of thing. Long-term care nursing is very, very detailed, but I think after this presentation, you will think twice about your specialty field. And when I say specialty field, long-term care nursing is a specialty field. So we're going to jump right into the myths. And like I said, I did read this article. However, when I talked to some of the peers that I have and the other students that I've dealt with in nursing, a lot of them agreed and said the exact same things that this article had said. So I'm going to kind of go off the article, but then I'm going to give you a little bit more information. So the first myth is that I will lose my nursing skills if I work in long-term care. That is one of the number one things that I hear from peers, is that they will lose their nursing skills. And quite honestly, it is not true. Long-term care nurses utilize their skills every day. Being a nurse in long-term care, you are the only one there to assess that patient and see what is going on with them. If they're having an issue with breathing, if they have a trach and need to be suctioned, you can't pick up the phone and call respiratory therapy to come down and suction your patient or give a breathing treatment. You cannot just pick up the phone and call the doctor and say, hey, can you come upstairs? I need you to see this patient right away. You are utilizing your nursing skills, your nursing judgment, and your critical thinking skills to manage your patients. But also, with management, management is totally different, especially for student nurses. You're really wanting to be that floor nurse and be doing those things, but management is definitely an option, especially for registered nursing students. I climbed the ladder very quickly through management because it was my love and my passion, and I did my best to work my way up because I wanted to make a difference in long-term care. Leadership, you absolutely have to be a leader. You are monitoring CNAs, you're delegating, you're communicating, and if you do not have good leadership skills in this type of setting, it's going to be a problem. Whereas in a hospital setting on a med-surg floor, for example, you have that charge nurse that you can go to. You have those doctors. You have other people, other nurses that you can lean on to say, hey, what can we do about this? What should we do about this? And you don't have, you do have some fallback in long-term care nursing. Don't get me wrong. You do have backup, but it's just not right there. It's not readily available. And then with assessment, and we kind of talked about that already, and the complexity of patients is really increasing. More and more patients are staying in their homes longer and utilizing home care nurses instead of going into a long-term care facility, whether it be assisted living, whether it be skilled nursing, or long-term care nursing. So the complexity of the patients is getting higher and higher because people are trying to stay in their own home for longer. And many, many people do not plan accordingly as far as their finances go. So myth number 2, I love this one. Long-term care isn't innovative, which is absolutely false. Long-term care facilities are adding innovative technologies at a rapid pace because of the complexity of those patients. So there's more nursing facilities that are putting dialysis centers into the long-term care setting, because in order for somebody to go out to dialysis, they have to be able to transfer. And because our patients are more and more sick, they are not able to transfer, so they cannot go out to a dialysis center. So nursing homes are bringing in dialysis centers into the nursing homes so that they can be, they can go in their jerry chair, or they can go in their bed and go get dialysis and not have to go out to get that done, which is also safer for the patients. Also, there's new charting technologies that's coming out. This has been a little while ago, but CNAs can now wear headsets that they document into, which helps create a better picture of the patients that we care for and actually what we do, in our role as nurses and as certified nurses as well. So just something else to keep in mind. A lot of people think they want to go into long-term care because, it's slow paced. You just pass out pills and you do wound care, and then you sit and you document, and it's, super easy peasy. It is not. Long-term care nurses are caring for more patients than the hospital does, and they encounter many family dynamics. So a side note for me is I never thought long-term care was easy. However, I had nurses that I hired that thought, I'm going to do this because it's, I work 6 to 2, and I'm going to have time with my family, and I'm not going to have to overexert myself. Okay. So not true. So as a nurse, you're taking care of anywhere between, depending upon the facility, but you're taking care of anywhere between 10 to 30 patients. And these patients are sick and they need help, and that is why they are there. So yes, you do pass pills, you do chart, you do wound care. However, in between that, you're getting phone calls from doctors saying, okay, how is this patient doing today? What was this lab value? How can we make this person feel better today? You are calling the family to update them about things. You're creating incident reports because Mary Jo just forgot that she, shouldn't walk without the assistance of somebody else, got up and fell out of bed. And then, you call the family, and the family's yelling and screaming at you on the phone because why did you let her fall? But by no means is this type of setting slow paced, and it is definitely not easy. A lot of people say that long-term care nurses don't make good money. Also, not 100% true. I did some research, and the average salary for nurses, registered nurses, is $34 an hour, which is pretty accurate, I would say. But it also depends on on experience. It depends on your hours. It depends on, if you work night shift, there are shift differentials. You can get bonuses for beginning to work for long-term care, which is another thing a lot of people don't understand. Because there's so many folks that are needing help, there's just not enough nurses. And I know we talk about the nursing shortage, but the nursing shortage in long-term care is astronomical. And so people are willing to pay more than the $34 an hour, which is the national average, is the number I took from. Hospital nurses make an average of $36 per hour, and that is a national average. Again, these are all averages. So we're talking from California, where nurses make a lot more money because of cost of living and the amount of patients and things they have, to Wyoming, where there's not as many patients. And so you're looking at a wide range of salaries. And so take these numbers really with a grain of salt. I wanted to share with you, when I was an LPN in 2006, I started out as an LPN in a long-term care facility. I had 22 patients, and I was making $24.50 an hour. So if we think about that, that was 12 years ago. And pay climbs and climbs and climbs. Another idea I wanted to give you is I was a director of nursing before I had my second daughter. And once I had my second daughter, I was afforded the opportunity to be able to stay home for a while with her. However, that was 3 years ago. And when I left, I was making $110,000 a year as a director of nursing in a long-term care facility. So just some numbers to think about. Like I said, don't put too much emphasis on the numbers that I'm showing you. This is just kind of a guide for you. Long-term care nursing is redundant. Wow, that is also false. The truth is, nurses are changing and adapting to what's going on. You are not going to have the same 20 patients every day. You are not going to have the same 20 patients that are healthy and don't need anything extra every day. It is constantly changing. The nurses can make or break an environment. So if you think that it's redundant and now I'm going to go in at 6 o'clock and I'm going to do my pill pass and I'm going to be done by 8, and then I'm going to do my documentation, and then I'm going to do my wound care, and then I'm going to do my med pass, and then I'm going to do my wound care and treatments and those, and then I'm going to, pass off the shift. And that's what I'm going to do every single day. That is not true. So nurses need to be aware that the environment is ever changing. You have to be on your toes whenever you are on the floor. Have to be on your toes. So the stability of the environment is based on the nurses that are caring for the environment. So if the nurses are taking into account, hey, things are going to be thrown at me today that I did not expect, then your attitude and your body language is going to help the environment of the facility and of the floor. And it's really hard to explain how that all works until you see it firsthand. But you're passing medications, you're doing treatments, you're doing wound care, you're calling doctors, families, dealing with hospice providers, dealing with lab people that come in to draw labs, x-ray techs, IVs, dentists that may come in. It's never redundant, and there's never one day that is the same as the other. Another myth, is that all patients in long-term care facilities go there to die, which is not accurate. That's not the only reason that they go there. A lot of people will go into long-term care and will go back home. Or what we call graduate to assisted living, where they're able to do things for themselves. But the other reasons why patients are admitted is because they're not getting the care they need in the current environment, which unfortunately I have seen a lot in long-term care. We get phone calls and the hospital saying, Mrs. Jones came to the hospital and, she's got bed sores and she's not being taken care of at home. Can you please, accept her? Because she just wasn't getting the care it wasn't that she was, going to die. It was because she needed added care that she just wasn't getting at home. They require increased stimulation and socialization. So if you have Mrs. Jones who's been at home, by herself this whole time, she's isolating, and people thrive when they come to long-term care facilities because they get that added stimulation and they get the socialization and they get to play bingo and they get to make friends. And it's not just for them to go and die and not for the next reason, not have a purpose. A lot of the folks that I've dealt with, they have responsibilities, and they then once they get those responsibilities, they feel they have a purpose. And what I mean by that is responsibilities, meaning they go out and do the garden with activities. Maybe they get to know somebody else, and maybe that person's not as cognitively aware, and they can kind of help with that cognitive portion of things and say, oh no, don't you remember me? I'm Fred, I'm your roommate. So that's what they're there for, the same thing. They're there for purpose. They are very vulnerable, and that is your job as a long-term care nurse, is to protect those people. Some people don't have family. Some people don't have friends to look in on them and make sure that they're, being taken care of and that they're thriving and those kind of things. And they're very vulnerable. They're a vulnerable population. In fact, any type of abuse, whether it be, there's different types of abuse, whether it be neglect, physical abuse, sexual abuse, exploitation of funds, or like a neglect. So those are all the types of abuse. And if you are, you or somebody is convicted of that, it's a felony, because it is it's a felony against an older adult. Anybody over 65 is considered vulnerable, and anybody that has mental retardation or mental retardation, they are also considered a vulnerable population. So you are responsible as the nurse to make sure that they're cared for and that they are, that these types of abuse aren't happening to them. And a lot of people believe that they are unimportant when they come into, the long-term care setting. They'll say, oh, my kids don't care about me anymore, and I don't have anything to offer society, and those kind of things. And nurses really, and long-term care staff really help to kind of change those beliefs for those people and make them feel more important. All registered nurses in long-term care are in administration and do not do bedside care. Also, not true. Registered nurses do play a major role in administration because of federal regulations. Federal regulations require that there is a registered nurse on site 24/7. Federal regulations also require the director of nursing to be a registered nurse. That is different than in assisted living. But as far as skilled nursing and nursing home care, that side of long-term care, that is the regulation. But the administrative nursing staff is typically people that are seasoned in long-term care and that understand the long-term care regulations. But lots and lots of nurses still do bedside care. The one thing I liked about being in the management role was that I had the choice to sit at my desk, do my paperwork and stuff. And if I wanted to go out and I wanted to see my residents and I wanted to interact with them and I wanted to do activities and, I wanted to go and do exercise with them, I could. And I had that opportunity to do that. Because bedside care is still and always will be my passion, but I never lost it just because I went into management. So also something for you just to know and be aware of. Long-term care is not as useful as a hospital. I hear this a lot as well, especially from my colleagues that do work in a hospital. They say, oh, well, you work in long-term care. You don't know anything, or you're not as good as us in the hospital setting. And it's not true. Long-term care nurses are needed to care for people who leave the hospital. When they do leave the hospital, either they're going to go return home, or they may need to come to like a skilled nursing facility, or they may need to come to a nursing home because they require continuous care. The hospital is more focused on what physically, mentally do we need to do to fix this person so that they're safe to leave the hospital setting. When they come to long-term care, we take them in and say, what can we do to make their quality of life the best it can be, and how can we get them back to their baseline? Meaning, if they came from home and came into a long-term care facility, are we working to get them back home? Are we working to make them comfortable where they are? A lot of it is about the goals of the patient, but that's always something that nurses are thinking about, especially on the long-term care side of things. And the number of people, and we talked about this a little bit earlier, the number of people requiring long-term care continues to rise. And that is because of, the baby boomer generation. And, the nurses that are doing the bedside care are getting older, and they're not able to do that bedside care. Bedside care in a long-term care facility is not easy. It's a lot of, lifting. It can be physically taxing on your body. But but it's so rewarding. So just keep that in mind. And a lot of people think nurses are on their own in long-term care. And to a certain extent, that is right. So when you are in a hospital setting, like I said, if you need somebody to be sectioned, you can call the respiratory therapist, and they'll come right up and do your suction for you. Or same thing with nebulizer treatments. Or let's say your patient's oxygen level is dropping, you just pick up the phone and call respiratory therapy. Whereas in the nursing home, you can't do that. You can pick up the phone and call people. Nurses often have the administrative staff to fall back on, that be the director of nursing. There's usually usually an assistant director of nursing. There's an MDS coordinator that's usually a nurse. So there's a lot of administrative nurses that you can go to. But when I say that you're by yourself, you don't have the ability to pick up the phone and call RT. You can't pick up the phone and call the physician and have them there right away. But long-term care nurses have to build a relationship and collaborate with a number of different people. So you are collaborating with each other, your peers, you're collaborating and delegating to CNAs. You are collaborating with the social worker, and you're collaborating with the family, and you're talking with the physicians and the medical director and the pharmacy staff, and on and on and on and on. And then you have outside agencies that come in, like hospice agencies, that you have to collaborate with, and it becomes this huge working relationship that you're in, and it's really feels like a family, because you are with those people day in and day out, and you have to build those strong relationships or you will never succeed in the long-term care setting. And the last myth is long-term care nursing is not fulfilling. Like I said, I love long-term care nursing. I think it is a wonderful, wonderful thing. And a lot of long-term care nurses believe that this type of nursing is the most fulfilling line of work, because you get to see that patient grow and change as an individual. You can sit and hold their hand in their time of need. You can change their perception about death and dying, let's say. You become their crutch and their go-to person when they need something and when they need help. And that is very fulfilling. So what you put in, you will get back over and over 100 times. So it's hard to explain it, but it's definitely something that that people will say. And so just for conclusion, just to the PowerPoint slides, this quote is amazing. I've learned that people will forget what you said. People will forget what you did, but they will never forget how you made them feel. And that's a quote by Maya Angelou that I live by day in and day out when I care for my patients. The patient may be screaming at me, they may be hitting me because they have dementia, and they, don't understand that they can't leave the facility to go pick up their kids from the school bus stop, because they think that that's what they're supposed to do. It's 3:00. I need to get there to pick them up. And, they can sit there and hit you and kick you and be really, really upset with you. But as long as you are able to remain calm and remember that they're a person and care for them that way, they are not going to forget it, even though they have dementia. And guarantee you their family will not forget it. It is a very, very rewarding line of work. It is not easy. And I encourage you all to seriously consider going into long-term care nursing, because it's not as bad as everybody says it is, but it's not all roses either. You're going to have hard days. You are going to say, why did I even do this? Why did I get into this line of work? It probably will even make you question why you're a nurse. I've been through that a few times, but I really hope that this whole thing has helped you to kind of further understand what long-term care nursing is all about and where really you can go with it. The sky is the limit, and you just have to jump in. And I say jump in, all in, don't just tip your feet in, jump all in and see if it's for you. And I hope that it is, because we need more and more nurses and student nurses to make that commitment to be long-term care nurses. So I challenge you to go into long-term care nursing, and I hope that this video will help you to consider that. Thank you.